So this is a common problem, and it's an increasing problem in my caseload. Before it was always like elimination problems, and now I see an increasing amount of cat aggression, sometimes cat to cat, but also obviously human-directed aggression. And I don't think it's a coincidence that this is an increasing problem with the rise of indoor-only cats, because one, we spend more time with the cat, and when you're in more contact time with the cat, there is more opportunity for conflict of some sort to arise, okay? The other thing, and we'll talk about this a little bit more later, is that we have higher population densities in a smaller space, and that includes not only the people and the cat, but there may be other cats, and maybe there are dogs or kids or ferrets or whatever. And I don't care if they're different species. When you stick a lot of individuals in a smaller space, again, there is still opportunity for more conflict to occur, or resource guarding issues if that happens. So I think that becomes more of an issue. The other thing is that we have loss of behavioral choice when they're indoors. And we'll talk about this again a little bit later, but we know that in cats that are under chronic stress, they sometimes actually behave less. So they're more passive, they lay around more. Dogs that get anxious often get up and pace around, and they pant, and it's a much more annoying issue to the owner. It's a more visible welfare problem to a dog owner generally than it is to a cat owner. Even dogs that show welfare problems by hiding, it's a more visual issue to a dog owner because we think dogs should get up and play and go for walks, and then when they don't want to do that, the owner perceives a problem. But how many of you that work with cats have ever had an owner call you and say, "My cat lays around on the bed too much"? Like, I've never gotten that call, ever, because they think that means the cat's happy, content, okay? So they're around us more, and instead of like, oh yeah, I have him so he kills mice out in the barn or whatever, now there are little babies or there are little substitutes, they're friends, and then we want to do stuff like this to them. And of course they bite us, okay? So the other issue with cats is I don't care, you work with some bad dogs, but cat bites are bad. And they often get infected easily, and then of course there really, as a play on the title, there really is a risk for cat scratch fever in some instances, especially with immunocompromised people. So children, elderly, people that again are immunocompromised or taking drugs that impair their immune system, or maybe their microbiome is screwed up so that their immune system is not well developed. And then the injuries can be more than a nuisance and sometimes land you in the hospital. So we also have loss of the human-animal bond, which might lead to relinquishment or euthanasia. And then family conflict too, because sometimes there's one individual that's getting targeted more than another, and like dad loves the cat, but the cat attacks the wife when dad's at work, and then there's disruption in the family dynamics on the human side as well. So what influences aggression directed towards people? Well, genetics does, just like everything. So one, we know there is a paternal influence on friendliness in kittens. Obviously, their perinatal environment. So again, from the last lecture, we know that perinatal stress to the mother or to the kittens is going to influence their stress response system on a number of levels, and that is frequently permanent. So those animals may have a hyper-responsive stress system, okay? A stress response system, which will influence any stressor in the environment, not just their interaction with the person, okay? Orphan or early weaning status, and I don't know that we have any good data on this, but how many of you anecdotally at least feel that orphan kittens are more likely to be bitey or have some type of behavior issue. Okay? I would agree, but again, we could all be deluded, but it's at least our impression, and if I'm deluded, then we're all deluded together. Obviously, there's socialization history, because we do a terrible job socializing cats. Terrible. Aside maybe from, I don't even know if this is true of parrots. I was going to say maybe from parrots, our cats are probably the worst socialized pet species that we have. Because when I think about people that get parrots, and they maybe get like a hand-reared parrot, so I think some of them even do a better job getting their birds out and exposing them to things. But certainly they suffer when it comes compared to dogs. And then their training, because then how many of your clients, before you get to them, tell you that they did some kind of training with their cat? Actually, I have that. I have one client that did that, and somebody has probably one client, 2 clients, okay? So we just, they're illiterate, skillless animals, unfortunately. That sounds terrible, but you get what I mean. It's not their fault. If you choose to lock your children in a closet in your house for 15 years, it's not their fault, but they're illiterate and skillless, and messed up. So their medical status, the microbiome, again, I'm going to say this probably like 50 times during this lecture. Pain, arthritis, again, anything that makes them feel bad, sensory changes could be a factor. Their housing arrangement, we think maybe that's not a big deal, but I mentioned density before, and density matters because, again, if you take a bunch of individuals, no matter what species they are, and you cram them in a small space, if there's any conflict between any of the pairs, the baseline stress level goes up, right? Okay? So that's going to potentially make the animal more disturbed by other stressors. So not only the density, but then the total space, because yesterday, for those of you who are here, we talked about how much space cats use in a natural environment, all right? So average home range for cats, 64 plus acres, depending on whether they're group living and whether they're male or female. So the owner's knowledge base, a lot of times we're extrapolating, especially cat owners that own dogs also, or maybe had dogs first and then they get cats, and then what do? They extrapolate out, oh, he's trying to dominate him, he thinks he's the head of the pack and stuff. And then sometimes they pull across training techniques too, where they literally try to do like little kitty alpha rolls. You can imagine how that goes. They do that like once if they're smart. And then they miss body language. I just put this in here because I thought it was really funny, not because it's really educational in any way. But and they miss a lot of body language issues. So I don't think we talk about this enough, but trigger stacking happens in everybody, and there is no trigger stacking diagram available on the internet for cats. It's all about dogs. So somebody fix that. Maybe we can get Lily Chin to make one for cats, all right? But trigger stacking happens, and that's why you're thinking, okay, human-directed aggression, what does, again, density and being inside and stuff have to do with that? Well, because if there is a high density, not enough space, lack of behavioral choice, no hunting opportunities for the cat, maybe the owner isn't even playing with them, there's no hide spaces, crawl spaces, climbing spaces. Well, my stack just got really big, and then when the owner goes to kiss the cat on the bed, So it's not just about the interaction with the cat and the person, it's about all the other baseline stressors that are now affecting our indoor cats. So these are some of the more common Types of aggression, or like labels. Again, unfortunately in the medical community we're really stuck on labels, partly because of the way our medical records go, you know. So play or predatory type things, fear-related aggression, redirected aggression, which is a big one in cats. Territorial aggression, which is probably less of an issue with people, but it does happen, and I think I have a video later in here where you'll actually see a cat that has a component of this. And then what we call petting-induced aggression, which if it was a dog, we'd call it conflict-related aggression, because again, we don't have any better names, and basically the cat wants you to leave it alone, and you mess with it. And then sometimes we say things like irritable or frustration-induced, or again, proximity-related. Again, the cat wants to be left alone. Maybe the cat's not actually afraid of you, but you go try to mess with it, and the cat's kind of like, God, just leave me alone right now. That's what I do to my husband in the morning when I'm getting ready. You know, like I'm not a morning person, and he gets out of the shower and he's all lovey, and I'm like, I've got like a hot iron, and he's like, and I'm like, God, just leave me alone right now. I have a hot iron, and you know, so that's what I would call irritable aggression. And I think our cats, you know, and our pets sometimes have a version of that. So what do we look for? Signalment. What is the age, the sex of the cat, reproductive status, their housing and background again. And then we want to know the members in the household, so not just the people, but the other animals that are there. I want to know their enrichment. Is there an enrichment program in place? You know, most cats that I see, there is not an enrichment program in place, because I don't consider, you know, 10 minutes of play a day an enrichment program, although it's better than 0 minutes of play per day. Other animals, and then the location of the resources, because where does the cat have to go, and what potential stressors does the cat have to encounter on a daily basis just to access routine reinforcers? Where does the cat have to sleep, and can it sleep undisturbed from other animals or people or children? Where does the cat have to go to eat or use the litter box? You know, one of the cat wasn't aggressive, but it had a litter box problem, obviously. And the cat's litter box was located, you know, the master bedroom went into the bathroom, and then they put the litter box basically right in the doorway between the master bedroom and the bathroom. And of course, the cat was going to the bathroom behind a chair in the master bedroom, and I'm like, well, like, you walk past there like 50,000 times a day, you know. So even if the cat doesn't bail on the litter box, if that's stressful, like, oh, I gotta go to the bathroom, I'm in here, and I'm like, look, they're looking at me, and it's still affecting the cat's stressor stacking level. So, how many of you watched My Cat from Hell? A few of you? All right. I don't really watch My Cat from Hell. I've watched it a few times, but this is a little segment I actually pulled off My Cat from Hell because I thought it was a kind of like good way to demonstrate this, especially when we talk about applied behavior analysis. So what's the behavior history? What is actually the behavior that's the problem? And then we need to know, when does it occur? Where does it occur in the home or the property? Who's present? Who's the target? And then what's the cat's body language? And then another question years ago that Susan Friedman commented on that I now ask frequently is, when doesn't the behavior occur? Because sometimes that gives you as much information as knowing when it occurs, okay? So this is Ruby. Program in place, because I don't consider, you know, 10 minutes of play a day an enrichment program. So you saw the behavior, and what you probably couldn't hear too well is she's a Pilates instructor, and so when people come to her, she does it inside her home, and when people come to her home, she has to get the cat and put the cat in the bedroom while she does her sessions. And then when she goes to get the cat, to put the cat in the bedroom so she can do her sessions, the cat does this, okay? So that's sort of like setting you up for what's going on. All right, so what are our setting events for Ruby? Well, one, it's the time of day because she puts the cat away in the morning before all her clients start to come, okay? Then it may be the Pilates equipment because she gets the equipment out before she goes and gets the cat. So the cat's probably already, you know, a little bit aware of what's going to come next. And then, of course, she goes to get the cat, and Ruby runs away, or if she actually gets her hands on Ruby, Ruby growls or hisses, swats at her, and turns around and tries to bite her, or actually does bite her because she's been bitten many times. So then we say, well, okay, what's our functional analysis, our ABC? So what is the behavior? We're going to show a different clip here for a second, although it's related. So with this particular cat, let me show this one. We're going to talk about what is the behavior, and I want you to watch this video clip and then also answer what happens immediately prior to the behavior, which is the antecedent, okay? And what happens immediately after the behavior. So yes, retreating or avoiding the hand, all right? So that's the actual behavior. What happens to the cat immediately before it does that behavior?
Hand reaches toward the head.
Right, so the hand reaches towards the cat's head because when doesn't the behavior occur? When she reaches for the cat's back. And then, of course, when she reaches for the cat's head and the cat ducks away, what is the immediate consequence? The cat doesn't get touched on the head, which is where the cat doesn't want to get touched on the head. All right, so this is Ruby again. So the behavior is biting the owner's hands, okay? And let's watch the little video. So, of course, the immediate antecedent for Ruby is what? Actually reaching toward her body and touching her. There were some, again, setting events that happened before that, like her walking toward the cat or setting up the equipment, and then I said potentially the time of day as well. And then, obviously, the immediate consequence to the cat after her biting the owner is the hands withdraw. And then what do you think a secondary consequence is? Okay, related to that, I suspect, but maybe phrased differently. To?
The confinement area.
Yeah, so the cat avoids being confined in the bedroom, okay? All right, so let's go back to our medical evaluation, whatever case it is. So pain, so obviously is it possible that Ruby's in pain, so when she touches her and picks her up, that she is reacting that? Absolutely. I think this cat, I might have put in there, is like 3 years old, but that doesn't mean she can't have a pain source, okay? Older cats especially, sensory losses or changes in their sight or hearing for a variety of reasons. Dermatologic disease, because again, if they have painful, inflamed, or itchy skin, or something like that, or they have rolled noses or whatever, the cat is going to be uncomfortable and again, may not want to be touched. Feline hyperesthesia, which is not really a neuro thing because it could fall under a number of these. Gastrointestinal disease. Again, ortho or neuro things might affect not only the cat's mobility, but again, the cat wanting to be touched and handled. And then, at least in our middle-aged and older cats primarily, hyperthyroidism, which absolutely does make a lot of these cats more irritable. So in a way, these are part of their stressor stacking, all right? Because medical conditions go on those stressor stacking lists also. For older pets, cognitive dysfunction or any medication that might affect cognitive function or medications that might affect other physiologic parameters that might make the cat feel, again, jittery or uncomfortable in some way. So how do we proceed forward? So one of the things obviously is educating owners, because I mentioned before, a lot of them don't, even though they've had cats for a long time, it's just like people that have had dogs for a long time, they're not necessarily good at reading body language. So talking to them about normal cat behavior, so one, I want owners to understand the stressor stacking effect of those parameters that may be happening in the home, including the indoor status and the lack of the cat's ability to engage in a functional repertoire of behavior. That may not be right on their radar as contributing to the problem, but why do you think one of the reasons Ruby probably doesn't want to get confined to the bedroom? Space. Okay, we don't know where the resources are. I mean, I'm assuming maybe there's a litter box back there, but maybe not. Or who knows where our food and water is. Lack of choice. What did somebody? What did you say? Right, so this isn't necessarily an antisocial cat. And do you think when people come into the house, it might actually be kind of enriching for Ruby to be out there and smell what's on their shoes and be involved in the process? You know, so if the cat's already lacking enrichment and now the owner is basically trying to deprive her of what few variable enrichment activities she's actually getting, of course the cat's going to go, I don't want to be in the bedroom. All the fun is out here. This is where the reinforcers are. Why would the cat want to go get locked in the bedroom by herself, alone, you know? So behavioral and physiologic needs, and then obviously the cat's individual personality, because, you know, I always feel sorry for those people that get a cat, just like the dogs, like they want to cuddle on the couch, and then they get the border collie cat, you know, and I'm like, I'm sorry, you just didn't get the, I hope there's no Persian people in here, but, you know, like the, you know, the like Persian that's just going to lay there and either purr or be cranky. So you just didn't get that cat, and you need to understand you got the border collie cat, you know? And then body language. I find that most people miss these cats right here. They can tell this cat, they definitely can tell this cat, but they miss this cat frequently. You know, the ones where they just start to get a little bit squinty-eyed and their ears just start to rotate to the side a little bit, but they're still kind of sitting there, you know? And people don't recognize that, and then they go in and try to touch them or pet them anyway, you know? So what about our hierarchy of interventions? Everybody's probably seen this diagram or a variation of it. So we start with controlling the environment. So your antecedent controls, obviously you start with medical, nutritional, physiologic first, down here, health and nutrition, but then your antecedent arrangements, and again, controlling the environment. We also then want to improve the bond between the owner and cat. She clearly loves her cat, but trust me, there's a little rift going on right now, and obviously our management and treatment program itself is going to help with that, but any other things we can do, like education, to help improve the owner's understanding of why the cat's doing this, is going to help with the bond as well. And then make the desirable behavior easy and the undesirable behavior hard. So what's really this owner's problem? From the owner's perspective, what's the problem? What is the solution or the problem that she needs to solve?
She wants to get the cat into the room easily.
She needs to get the cat into the bedroom, all right? Because she needs to do her job. That's the real problem. It's not that the cat's biting. It's really that she needs to get the cat into the bedroom, but she needs to do it safely, all right? So be thinking then, how do we make getting the cat into the bedroom easy and make staying out hard without doing anything horrible to the cat? You know, like we're not going to chase it around with a broom or something like that. So find non-confrontational solutions to the problem, and then if there is punishment in place, obviously we want to try to eliminate that because that's not going to help us. So if we can, we want to choose a substitute behavior that serves the same function for the cat. Like, is there another way for the cat to tell her, don't touch me? And again, the cat very well may be saying that, but they're missing the earlier warning signs and going right to the because the earlier warning signs aren't working. Plus, she's frustrated because she's got to get the cat to move. So enrichment. Enrichment is part of my program, honestly, for every single cat, even the old, demented, deaf, half-blind cats, you know? Because one, if you are demented, you still need enrichment because that's probably half why you're demented to begin with. There's only so much we can fix. But again, if these are indoor cats and we're looking at the stressor stacking effect, I want to take as many of those stressors out. We need to get the animal doing normal behaviors so that the cat has some control and choice over its environment. So as we talked a lot about yesterday, foraging, play, and predatory mimicking sessions, and making sure the cat has good use of the space, so like climbing areas, hiding places, and then sensory stimulation and exploration. So then we want to put safety measures in place because especially, you know, Ruby has a very specific, clear trigger. Some of the cats, the provocation for aggression is much lower. Like you really pretty much have to get your hands on Ruby before you have a problem. But some of the animals, proximity is an issue, or these cats that are doing ambushing where the owner doesn't even necessarily see it coming. We do have to put safety measures in place. So just like any behavior problem, how do we avoid problem situations so the cat doesn't rehearse the behavior issue and so that nobody gets injured? And if need be, confine or separate the cat, all right? You'll see this cat and owner again in a little while. So this is Eloise, and Eloise ironically lives with Charlie, who you saw in the previous lecture. Well, they live in the same house, let me put it that way. Eloise belongs to the daughter, and Eloise lives upstairs in her own few rooms with the daughter, and the dog and the cat are not supposed to be together because they can't. And one day, Charlie got up the stairs to the door, and the dog and the cat went at it through the door, and Eloise was freaked out, and the owner, not the daughter, but the adult owner, went up to check, and so the cat's like totally freaked out, and she opens up the door, and the cat wigs out and literally just beats the tar out of her, okay? Like chewed her up bad. And from that moment, single event learning, Eloise cannot stand the sight of Leslie, okay? But Leslie's daughter is away at school, so Leslie has to take care of Eloise at times. So one of the things we do is like, well, how do we set up safety? So this is a little arrangement that we made to help care for her, but also we're going to use it later in behavior mod. So she pushes the food under the gates. And she can't obviously open the door without having a way to close the door. So like taking the gates halfway down and reaching across to close the door was not an option, which is why we came up, like I said, we tie the ribbon onto the door handle, she puts the gates partly up, opens the door, gates, and then we have the ribbon to pull the door closed before she removes the gates to, go back downstairs or whatever, okay? So we also want to teach the owner redirection strategies. So when Leslie does go into the room, or you have an owner, again, that has cats that are ambushing them, partly out of play or predatory, they need ways to redirect the cat without spraying them with water or like yelling at them and like trying to kick them off their legs, because a lot of those cats then start to become more defensive, and then you have a real aggression problem instead of just a sort of annoying aggression problem. So we do this with treat tossing, toy tosses, obviously, to redirect the animals, especially those that are showing play-related or predatory behavior, using response to a trained cue, and then also conditioned phrases that basically reframe the situation for the cat. So for example, if you condition, most cats, or a lot of cats, know what can openers are, or the dogs know the sound of the cookie jar, and whatever they're doing, you pop the can opener or the can or the cookie jar, and the dog or cat's like, or hey, we're going to run in there. Instant sort of happy animal. So you could do this with a sound, or you could condition some type of a verbal phrase where we basically kind of turn it into a clicker, even though we're not using it to reinforce a specific behavior, but basically to get an emotional shift and reframe the situation and diffuse the cat so the owner can get away, or again, bring the cat's arousal enough that maybe the cat will wander off by itself if the cat is not actually separated. And then I also have owners put heavy blankets around the room for some of the more serious situations. So if the cats do become aggressive, you just drop a blanket over top of the cat, they exit the room, and let the cat come out on their own, or if absolutely necessary, scoop the cat up, take the cat into another room, and close the cat away and let the cat diffuse before interacting with the cat again. So as I mentioned, avoiding the problem situation. So obviously if the cat's aroused, if you have cases of redirected aggression, if the cat's aroused in the window, we don't want people to go over and see what's going on. Like, Fluffy, what's out there? Obviously, if it's a petting-induced problem, stop petting the cat, especially when the cat doesn't clearly indicate that it wants to be petted or initiate the contact itself. And then for some of the interactions that you saw before, stop the inappropriate interactions. This owner may either think the cat's playing or think it's funny enough that they really don't care that the cat's not entirely playing, but then he'll care when the cat actually chomps on him. So as I said, we confine them if necessary. So for example, Eloise not only has to live confined, but even if she didn't, if Charlie wasn't in the house and something like this had happened, her aggression was severe enough that she could not be loose in the house with Leslie. Like, it was just too dangerous for the owner. So I set up a cat room, or as you saw before, we set up some type of a safety door or gate area to prevent escape. Sometimes we obviously double gate the doors or gate doors. Even if we're going to keep the cat behind a closed door, I often have people put a gate across the door also, so that when they open the door, the cat doesn't quick slip through the crack in the door, so it buys them a little time. Obviously, some of the really agile cats can get through the crack and over the gate really quickly, which is why Eloise had like 3 gates on her door. But it does at least give the owner a little bit more control over the doorway when they're moving in and out of that room. So then teaching an incompatible behavior for whatever issue. So play behavior if the cat is ambushing. We want to obviously redirect the cat to play, make sure there's a good enrichment program in place, and make sure owners are directing them to toys rather than their hands or body parts. Train stationing. So we did some stationing with Eloise because when we got to the point where we had Leslie actually going into the room with the cat in the daughter's presence, we didn't want Eloise at the door. So Eloise needed to have enough training that we could call her away from the door, get her up onto her cat tree on her station to allow Leslie to come in and out of the doorway basically unmolested and with some safety in place, all right? Might be teaching the cat to rest quietly during handling or, you know, some sort of basically counter conditioning for petting, or even moving away. So when I do deal with cats that are either ambushing people or really apprehensive about visitors, for example, or certain family members walking around the house, we actually do a lot of reinforcement training the cat to move away, okay? So a lot of cats, when they get scared, of course, they move toward what freaks them out, and they beat the tar out of you. And if we can just start teaching the cat to disengage and move away instead of getting into a confrontation, we maybe haven't repaired the bond with that individual yet, but we have at least put a safety measure in place that, again, the cat's inclination is to move away rather than approach and attack. So this isn't a cat, but it's actually, but it's actually kind of a nice little video, again, just reinforcing an alternative behavior. How many of you have any experience with ferrets? Oh, wow, great. I don't actually think this ferret's aggressive, and you can tell me if you disagree, but the ferret does bite. For those of you that don't know ferrets, ferrets do cache, for one thing. They take stuff and they hide it. Like you can sometimes, I don't know, go in a corner of the room and there'll be like 50 like toys or hair bands or whatever they find, and they stash it, all right? This was a rescue ferret. I don't know the ferret personally or anything. I just got this off YouTube. But the ferret's underweight. There's no, when I watch this, there is no, I guess, other signs for me that this ferret is biting in an aggressive manner. However, the ferret bites, the gloves you'll see, and actually tries to pull it in. So I think this is sort of a starving caching behavior, but obviously it's still inappropriate and will not make the ferret very adoptable, okay? So what they're trying to do is teach the ferret an incompatible behavior, which is to move away. See, you're trying to pull it in. So this is again a cute little example, or a nice little example of teaching an incompatible behavior, right? Then you can also train a behavior that makes the problem behavior irrelevant, such as targeting, recall, stationing, depending, again, on the problem that you're doing. So we'll get back to Ruby, but if you think about this with Ruby, what would be a behavior the owner could teach that honestly would make this whole issue irrelevant? Stationing, a recall. She said any of those three. Or yeah, so she said if you wanted to leave the cat out, you could teach the cat to station somewhere and like not be jumping on the person doing Pilates or whatever, okay? But like I said, even targeting, like if we've taught the cat to come or follow a target, then we have a non-confrontational way to move the cat into the bedroom, all right? Kiss, come! Kick out! You know, it's funny, after I watched this a couple times, I didn't really pay this much attention to it, but when you watch this video back a couple times, then you realize, I'm not sure the cats are coming because she's saying, kitty come, or because they hear the clink, 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 clink. You know, like you'd hear a spoon on a bowl in the background. Not that it really matters either way. So Ruby, of course, avoiding the problem, the first thing is I would tell her is stop picking the cat up, okay? But then we have to go, all right, well, how are we going to help her get the cat into the bedroom if she can't pick the cat up? Because we're not going to teach the cat targeting in a day. I mean, maybe you could, but... So you could throw cat treats down the hallway, all right? That's one thing. Obviously, I'm going to tell her to increase the cat's enrichment and meet the cat's behavioral needs, because again, if one reason the cat wants to stay out is because the cat's bored in the bedroom, then enrichment's going to help us a little bit, all right? What else would you do for Ruby? Again, if our goal, because practically we probably can't ask Ruby to sit on a stationing spot for a whole day of Pilates lessons, all right? I'm sorry? Okay, you could feed her in the room. Food puzzles in the room. Somebody said toys. So basically, let's make the room way more interesting than the rest of the house. Like, let's make Ruby want to get in the room. Like, if the bedroom door is shut, she's over there going, meow, meow, let me in, because that's where Kitty Disneyland is, okay? Well, because she disturbs the lessons. I mean, you know. And then, obviously, I would teach targeting, because if for some reason the cat doesn't, say, just follow her into the bedroom at the right time of day, or if she does go put the cat's breakfast in the bedroom and the cat doesn't come in, we have another tool to teach the cat or get the cat to move willingly into the bedroom area. This is like one of the coolest cats, mainly because he's a cool cat, but his owners taught him all kinds of really cool things. So we teach the targeting or recall, and then make sure that when the cat goes in there, that again, there's a lot of enriching things in the bedroom, and that the enriching things are rotated enough so that in the morning, when she really needs to get the cat in the room, that's when the bedroom is most appealing for Ruby, that she's going to find new and exciting stuff in there each morning, okay? So I do a lot, or suggest a lot, of harness and leash training with cats, especially when we're doing cat introductions. If I'm doing introductions with cats and visitors, or reintroducing a cat to an individual such as Leslie and Eloise, because they give us a lot more flexibility. You know, years ago we were always like, oh, put them in carriers, you know, put them in the room and feed them. But there's a huge contextual change between a cat being locked in a carrier and then moving freely around a room with another individual moving around the room. So I think the harness gives us a lot more flexibility, and also gives us a level of safety, so that if the cat lunges at something, you at least can stop them from making contact. Remote treat dispensers obviously work for cats too. So if you're teaching a stationing behavior, or if we have a remote treat dispenser in the bedroom where we want Ruby to go, she could maybe at some point even train the cat enough to send the cat into the room and remotely reinforce, or maybe remotely reinforce the cat intermittently in the bedroom during the Pilates sessions, okay? so that there is, again, just additional enrichment occurring while the cat's locked away in there. So then our Pavlovian intervention, systemic desensitization, so you're presenting your stimulus at a low level, you allow the cat to habituate to that level of intensity, and then slowly raise those intensities over approximations. Usually we obviously pair this with counter conditioning so that we speed the process up a little bit, but also sometimes get a better emotional conditioning to the situation. So again, just as a little example, this is Monique Fairchild working on basically husbandry, vaccine husbandry.
Of the skin. And just very gently pulling up on his skin and pinching the way that I would raise a tent to give an injection. Now I'm going to start raising the tent like I'm going to give an injection, and then I'm going to actually give a little pinch just in front, right where the needle would go, while he's having his food. In that tent, I'm actually going to poke with the capped needle, just right in that same area, and then we're going to stop.
So when we have specific problems like play and predation, enrichment's my primary intervention for these. Because again, these are pretty normal cats typically. Again, they might be that border collie version of the cat, so I'm not saying this is easy necessarily, especially if people are kind of low energy themselves and they work a lot and they're home, you know, they're gone a lot and then they come home and they're tired and they don't want to spend hours playing with their cat. But it's still the primary intervention that we do. And then we do, as I mentioned before, a lot of differential reinforcement for other behavior. Can I reinforce the cat for moving away from me? Can I reinforce the cat whenever I see the cat playing with one of its toys, or sitting up on its cat tree looking out the window, you know, or engaging with the owner in some other way that isn't ambushing and biting, all right? Repairing the bond, which again, one is just making the problem better, but then structured training sessions and play sessions and teaching the owner appropriate social interactions so they understand when to try to touch the cat and when not, or again, understanding when the cat's activity levels may peak or wane so that they apply the enrichment at the right time of day to get maximal effectiveness out of their program. Oh wait. So this is a true fishing pole toy because he actually has a fishing pole.
Cast it in all different areas of the room, and perhaps over here onto the settee, and then further down the room. Flick of the wrist, and away it goes. Jupiter's got it in a moment.
You know, somehow watching videos of dogs playing is not the same as watching videos of cats playing. Do you find that? Like, it's just so much more entertaining with cats, maybe puppies, but petting-induced aggression. So again, educating them about body language and about the limitations of their cat, like they may not be a touchy-feely cat. Also helping them define where the cat may like to be petted and what body areas the cat may not like being touched. And then duration's a big issue. Even in our dogs, I have a lot of people that come in and go, yeah, I was petting him, and then after a while, he turned and bit me. And I always ask, well, how long's a while? You know, like either how many strokes or how many seconds. It'll be like, oh, like 10 minutes. And I'm like, well, I'd bite you after 10 minutes too. You know, some people may like that, but even just doing this in the air with my hand is starting to annoy me because it's just really aversive to some individuals. So communicating better about touching will help the cat's tolerance, but then you can actually obviously do counter conditioning to improve the cat's tolerance for petting to a certain degree. I mean, there are going to be limitations. Again, we're not going to take the active, nah, don't touch me, I'm too busy right now, cat, and turn it into the lazy cat that is going to let you pet it for 30 minutes on your lap while you're watching television. But we can certainly improve their tolerance. I would give credit for this video, but I honestly don't know who it was because it wasn't labeled on YouTube. But this is a fantastic example of petting, counter conditioning in a cat. And one of the things I really like about this video too is that he's sort of simultaneously working on reinforcing the cat sort of for what I'll call polite behavior at the same time. Like the cat kind of jumps at him, he just kind of pauses the training, and then when the cat's sitting quietly, he kind of resumes the training as well. So just a really nice example of the timing of, you know, reaching out to touch and delivering the food in a cat that doesn't really like to be handled too much. So fear-related aggression, probably, obviously, besides play predatory, which I see a lot of cats that have that, are probably second greatest category when we're talking about human-directed aggression, are probably fear-related problems. And these can be people, obviously. Sometimes it's handling, as I said, but the other issue is that we see a lot of cats that have sound-induced attacks on people or owners. So how many of you have had cat cases, for example, where somebody in the house sneezes and the cat attacks somebody? So those are shockingly not entirely rare. One case where every time they turned on the coffee maker or the computer printer, the cat literally would race across the house, find the wife, and attack her. I don't know why. Maybe there was an event learning at one point where she was near one of those items and the cat got scared. I don't know how it started, but they were clear triggers for the cat going after just the wife, not necessarily not the husband. So again, establishing escape zones for fearful animals, and that means not only high spots, but hiding holes on multiple levels and in multiple locations in the house. So just sometimes like people, they're like, oh yeah, I have a dog bed, you know, in one room of the house, but then where does the dog have to rest otherwise? I don't want the cat to have one hiding hole in the entire house. They need multiple hide and escape routes and places to go so that they can feel safe. And then teaching training skills, as we mentioned before, and setting up desensitization counter-conditioning programs for specific trigger stimuli such as people or sounds. So this is Eloise again, and we basically had, Eloise was started on targeting, not here, but by the daughter, and then we had Leslie basically just start simple counter-conditioning sessions through the barrier. Through the barrier opens, Leslie's there, good stuff happens to the cat. Treats, meals, catnip, toy play through the gate, okay? So that we could not have done in the beginning. Eloise would have removed a finger. But this barrier just allows us, again, to start some simple exposure and repair a little bit of the rift in their bond. So for territorial behavior, like I said, fortunately, I don't see these cats a lot because some of these cats are really dangerous. This is a cat I saw years and years ago. So super high arousal just from the door knock, and then you can imagine what would happen if people actually went in, and then he goes and beats up the other cat in the house. So, you know, these cats, like I said, can be really, really dangerous because they're, again, arousal is high. 2 minutes? Okay. So this is a cat, absolutely, I would have some kind of confinement training, meaning one, we have a way to safely confine the cat away when visitors come, but I also want the cat in a carrier or harness and leash trained, because there's no way I'm bringing a visitor into the house, even on the other side of the room, and going, oh, I'm just going to feed him while you're over there, and then hope he doesn't run over the room and beat the tar out of you. Like, we're not doing that. So there's got to be some kind of safety measure in place. and then getting foundation. Really, doing cats like this is kind of just like working on dogs that don't like people coming in the house, you know? You get in some foundation skills, you teach targeting and stationing, you get them good on the leash, and then you start structured exposures where they do engage in something desirable, and if necessary, we medicate them to bring their arousal down enough that you can even get somebody into the house and still have the cat engage in the activity. Oops. So, speaking of, mentioned before, fear, aggression, people, noise-induced attacks, or redirected aggression from fearful situations. Other things, if the cat has generalized anxiety, as I mentioned, territorial aggression to cats or people, I might use medication for any kind of an arousal-related problem, like frustration tolerance, intolerance, or a cat that's just really irritable. Again, maybe there are stressors in the environment that we cannot control and remove. So we've got that stressor stacking effect, and we can't pull some of them out. So sometimes medication or supplements allow us to create a little bit better threshold and welfare situation, all right? So some of our supplements, Zilkine, Solaquin, Zentrol, we used to have Angstitane or a suntheanine supplement. These work very well for some cats. And if they don't, we move on to other things. Royal Canin Feline Calm, we actually have really good results with that in a lot of patients. So that's something we use as an adjunct in a number of cases. And then, of course, your pheromone products as well. Then when we get into actual pharmaceuticals, usually for aggression, my first line out of the gate is a serotonin modulator, such as Prozac, Zoloft, Paxil. This is Celexa. And now I'm starting to use Lexapro a little bit more in cats to, one, see the effect, but at least in humans, and my experience in dogs so far is they have a really low side effect profile. And sometimes the side effects that we get from Paxil and Prozac in cats are just not tolerable enough for us to keep the cat on it for a long period of time. So Nathaniel was 7 months old. He's a little bit older now, obviously. This was a pretty classic border collie cat, young, active cat. He lived in a very small one-room apartment with 2 owners and 2 small dogs. So there was a density issue, super dedicated owners. They loved this cat a lot, but there were a lot, again, of enrichment issues just because of the size of the space. It's an apartment. There's no place for the cat to go out. The apartment complex won't let them fence the balcony to give the cat any outdoor access. And so there was a lot of ambushing of the owner and biting when the owner tried to pet the cat, or attacking the owner when she was in bed, or the husband. It was both owners equally. And then he played with the dogs, but he also sometimes ambushed and attacked the dogs as well, all right? So he had already been on fluoxetine prior to when I saw him, really without any benefit. And obviously we put an extremely aggressive enrichment program in place, but we didn't get enough benefit from that because, again, there's only so much I can do with a tiny apartment with 2 owners that work all day. And so then we added in escitalopram at 2.5 mg once a day, and everything, honestly, right now is golden. Like the cat, she emails me and she's like, oh my God, he slept in bed with me for the first time, you know, and he's very affectionate. There has been no scratching or biting, and they are very dedicated to their enrichment program because they understand the value of that in keeping this cat on track. And someday we will try to wean the cat off of this, probably after they move to a bigger place, so they won't push our luck, but it's certainly not my intention to leave him on that forever. All right, I have to whiz through really quickly because Michael's given me the neck kill sign. Clomipramine, another one that we use for aggression in cats. Buspirone. You come tomorrow, we'll talk about all these in more detail. Benzodiazepines, which can work very well for generalized anxiety or that kind of irritable cat. And I'll skip through her. And then situational medications. A lot of you know about gabapentin and stuff already, and then I'm done.